She has a fever, she's sick, she has flu-like symptoms. I said, has she been exposed to someone positive? No, not that we know of. Did she travel to a hotspot? No. I said, then there's no test, and there's no reason for a test. Leave her home, help her, be careful that she doesn't infect you, but that's it. And flu-like symptoms, and a couple of weeks, she'll feel better, and she'll get on with it. The one thing I said to my sister is, don't let her go near Mom. It's my mother. My mother's in a different situation. Again, senior citizen, but senior citizens compromised immune system, underlying illness. I said, don't let her go near Mom, otherwise treat her as if she has the flu. Well, what do? What's self-quarantines? Well, self-quarantine is what we used to do when somebody had the flu, right? My father would say, go in the room, stay there until you feel better, right? That's crude self-quarantine. Don't get infected, stay away, throw things away, use hand sanitizer, etc. That's the reality of the situation. I get the drama, I get the anxiety, but all in moderation and all in connection with the facts. Questions, comments?
A few details. Essential services, does that include like building supply stores like Home Depot, Curtis Lumber? When does this order take effect? And then for the doctor, obviously healthcare workers are exposed, they're going to get sick, they're going to resolve. If you've been 14 days and you're resolved, do you get to return to the healthcare workforce? So I guess Governor, start maybe.
Yeah, Jimmy, I'll answer your question, but I forgot one thing. I want to show you the ventilator. Our main scramble now is for ventilators, and everybody says, well, what are the ventilators? What are the ventilators? This is a respiratory illness. We need ventilators which will actually, the ventilators actually help people breathe. This is the machine that you often see in hospitals. It's commonplace in hospitals. It's just the number that we need is much higher. And any manufacturers of ventilators, this is a national need. Every state across the country needs it. I'm talking to governors all across the state. GE makes them, Philips makes them, but this is the #1 device that we need because we can create more beds, but it's literally the supply of ventilators now. And countries all across the globe are all trying to get these devices. So that's the main challenge. The question on, after 14 days if you test negative, can you go back to work? You go back to work.
So she can be, is she?
I don't know.
Okay. And then for you, building supply stores, and when does this take effect?
We're going to have a full list of essential services. I believe, I don't want to get into any specific business right now, but we'll list all the essential services.
Governor, do you have any timetable how long these restrictions are going to last, just for parents, small businesses, et cetera, trying to plan?
No, but all of the restrictions are statewide. They will track the trajectory of the disease. If we get that spread down, Jesse, if we slow the spread and we can handle it in the healthcare system, we'll relax them as soon as possible. Past data, China, South Korea, shows that if you take more dramatic actions sooner, you actually reduce the spread and you recover faster. So more dramatic on the front side, the faster you get out of it. I've also spoken with elected officials all across the state. I've told them that this 50% mandatory requirement was going to be in place, and we've heard nothing but support. And I want to thank all the local officials, and I want to thank them for their cooperation.
Speaking of dramatic action, though, what about shelter in place? Can you explain why you're resistant to that and why that's no longer on the table for you?
shelter in place first would have to be done. I don't believe any policy works unless the geographic footprint is large enough. I'm from Queens, New York. If you tell me shelter in place and I'm living in Queens, I'll go stay with my sister in Westchester and I'll go out and have a good time, right? So it can't just be New York City. It would have to be Long Island, Rockland, Westchester, and the rest of the state. Also, shelter in place, you close down your healthcare system. You close down your food system. You close down your transportation system.
I don't think that's necessarily true.
Well,
In the Bay Area, it's certainly essential services
well,
like
it depends
food and-
how you do it. And you close down businesses. You close down all businesses when you do shelter in place. So that doesn't make sense to me because people have to eat, travel, et cetera. Doing it this way, all workforce 50%, except essential services. We'll see if that slows the spread. If it doesn't slow the spread, then we will reduce the number of workers even further. That 50% can be calibrated. Now, you could get to a point where you could get to 100% of workers stay home besides essential services. That's what Italy wound up doing. And we're at 50% now. But I would never shut down food, transportation, essential services.
Governor, the comptroller yesterday put out a new revenue forecast, as you know. Worst case scenario, $7 billion hit the state is facing. Will that require a cut in spending as you had initially proposed in the budget? Will this mean less spending for schools, for instance?
That's something we're going to have to work out in the budget. But as I said, the original estimates we did were before any of this, and they are, any reasonable person would say, too high. So we'll have to do a budget on the best projections that we can do, and then we go from there.
Does that mean then, is it time to look at raising revenue? You were reluctant to do that in your proposed budget. Now with such a big cold, you have to raise taxes?
Yeah, look, you have businesses closing, you have people out of work. I don't think now is the time to tell people we're going to raise your taxes.
Yesterday you said that you were reviewing with the Army Corps of Engineers. Have you met with them yet?
This afternoon.
And what are you hoping to, explain to them or find it out?
Army Corps of Engineers, well, let's say federal writ large, okay, because you have DOD, you have FEMA, you have the Army Corps of Engineers, additional hospital beds, the mobile hospitals, helping to retrofit existing buildings. Those are all within the purview of the federal government.
Governor, is the media considered an essential service? I know it's a tough question to be asking, but, and do we fall under the 50% umbrella?
That is a very good question. We have to ponder that. I think, are they an essential service? Depends who you would ask. I personally consider it an essential service, but I don't know if that's a global definition.
Dr. Zucker, are you investigating a cluster in Borough Park, Brooklyn?
We've heard about that and we're looking into that.
Do you believe it is a cluster, or do you believe it's a result of a
Which,
test?
well, there's two possibilities. There's a lot of testing that's going on, or potentially one or multiple individuals that have been infected. So that's something that's new on the radar and we're investigating it today.
Governor, Westchester was the epicenter. It's sort of moved now to New York City. When you talk about expanding the capability of hospitals, is Westchester an area where you're looking at perhaps opening some new temporary facility, and can you describe where those might be at this point?
Definitely. Our planning will track, again, it's science, it's data, we'll track where the cases are. So wherever you have a cluster of cases, that's where you want to add to the capacity. You look at how many beds you now have, how many beds you may need, and that's where you add to the capacity. New York City is the natural area for it to increase because of the density. Westchester was an anomaly, that whole New Rochelle situation. And look, we responded to it dramatically, and I want to thank the Westchester County Executive, George Latimer, who's done a great job. But we'll increase the capacity in Westchester, that cluster, and New York City. We also have a cluster in Nassau now. So wherever we see these clusters pop up.
It's the 50% rule of five. It's just New York State. You didn't get agreement from neighboring governors.
I have not spoken to them about it at this time to a point where we have agreement. Our numbers are somewhat worse. We don't yet have agreement with Connecticut, New Jersey, or Pennsylvania. But again, on this mandate, this one is not really geographically specific because a business can't pick up today and move to New Jersey to get around the mandate.
How fast are you looking to move on the state budget?
April 1. If they want to do it sooner, great. But the date is April 1. I'm going to be here. Government is functioning. Government is here. Police officers are doing their job. Nurses are doing their job. Correction officers are doing their job. A lot of people are putting themselves in harm's way. You have great public service heroes, those nurses who are at the testing stations, drawing blood. God bless them. This is public service. We'll be here. We'll be doing our job. If they want to come up and do the budget early, fine. Otherwise, the date is April 1.
What are you discussing with the DAs then later today? Are you meeting with them?
I met with the district attorney and criminal justice experts talking about bail reform.
Can you give us an update?
This morning. I had that meeting this morning, Zach.
Can you give us an update on New Rochelle, and is there any evidence that the containment zone in effect in that city has been effective?
You want to speak to that, doctor?
Well, we are still tracking cases in that area, in the whole Westchester County, but we do believe that the effectiveness of decreasing numbers is happening with that.
Yeah, but certain things are inarguable. It is inarguable, but to the extent you reduce density, you reduce the transfer of the virus. That is inarguable. So closing schools, closing gatherings, that is inarguable.
Governor, the sick leave bill is expected to be voted on today and passed. Do you expect to sign that today? And it's supposed to be
As soon as they pass the
immediately-
bill, I'll sign it.
When would people start benefiting from that?
The quarantine bill goes into effect immediately, right?
The quarantine bill goes into effect immediately. The larger paid sick bill, we're actually going to hold on and do in the budget, and that'll come into effect in 180 days.
Would people be getting checks from their employer as potentially next week or
If
whenever?
they're in mandatory quarantine or if they're in precautionary quarantine, it goes into effect immediately.
The governor, why amend that bill? Because obviously what was introduced yesterday had the statewide system taking effect later. What led you to split it?
We're giving a message, and we believe that's necessary immediately for the quarantine provision, but as this other part of the bill doesn't go into effect for 180 days, it's not necessary to give a message of necessity.
Bernadette?
Do you have a plan in place for law enforcement, specifically the NYPD and state police? But is the NYPD being provided with extra protective gear? And also, do you have a plan in place for what happens should any of these officers, et cetera, get ill?
Every police department has been advised to expect people to get ill. I mean, you know, you talk about a public-facing position in this environment. So reality would dictate you'll expect a number of people to get ill. I have mandated that New York City and all local governments have masks provided to their police departments.
Right, but do you have any plan should, you know, the NYPD need to cut hours? Or, and we saw in Philadelphia, they relaxed certain, they told officers to stop detaining people for certain crimes. So
I'll leave that to the local police departments unless there's a situation that requires state action. But right now, we're leaving it to the local police departments.
Governor, could you please expand more on your discussions on bail reform with the DAs and the criminal justice experts?
We spoke to the issue. You know, there's a divergence of opinion. I said to them that I'm very proud of what we did on bail reform. I think we made a significant difference. Obviously, there's people who have different opinions on what needs to be done now, and it was just a general conversation without a conclusion. It will be concluded in the budget. Let's take one more question, and then we'll get to work.
You mentioned that 108 people have been released from the hospital, and maybe this is a question for Dr. Zucker. Are those people out of the woods? Can you get coronavirus twice, or have they built up an immunity?
So you do build up an immunity to all viruses. Sometimes the immunity lasts for years, sometimes for your lifetime. And they are out of the woods. I mean, they've recovered that's a positive finding.
Doctor, you
remember
gave
this
these,
this conversation I had with my sister. If you take your daughter to get a coronavirus test and she tests positive, what do you think happens? They send you home and they say chicken soup and take care of yourself, and if it gets worse and you need hospitalization, call me. So getting the test and getting the result, all it really does is inform us to isolate that person so that person doesn't transfer it. But there's no medicine that you get for the coronavirus, right? It's just like a flu. The body has to develop its own immunity to that virus. We've been doing this testing just to slow the spread. And again, it's what I said to my sister. Keep her away from mom. Don't go into a nursing home. Don't go into a senior care facility. Don't expose a person who's immune compromised, who's recovering from cancer, who has emphysema, who has a respiratory illness. That's all this is. We're going to go to work. Thank you very much.